Anxiety isn't a unique experience. We all get anxious from time to time. Anxiety is in fact a normal human reaction to stressful situations. But for people with anxiety disorders, those fears and insecurities aren't occasional. It becomes more frequent and erratic, and could get worse with time. Welcome to Anxiety Hut. In today's video, we will be looking at the best types of therapy for the treatment of anxiety. Anxiety is much more common than one might think. Anxiety disorder in particular is common in both adults and children. Around 18% of adults in the United States have been diagnosed with anxiety disorder, and 25% of adolescents between the ages of 13 and 18 will experience anxiety. Anxiety disorders can severely damage a person's ability to function at work, in school, and in social situations. Anxiety can also affect a person's relationships with friends, family, and loved ones. Fortunately, there are effective treatments for anxiety. Regardless of how your anxiety surfaces, whether as an incapacitating phobia, obsessive thoughts, or a panic disorder, there's hope for treatment and a full recovery. Therapy can be quite effective in the treatment of anxiety disorder. A professional can provide a variety of treatment options and guide you through the learning and application of useful techniques and practices as preemptive measure and as a cure. Therapy can help you get the root causes of your anxiety and help you unearth those fears and insecurities that are holding you back from living your ideal life. Therapy arms you with the tools you need to fight and overcome the debilitating effects of anxiety and win back control over your life. Therapy often works hand in hand with medication, but the ultimate goal is to get you to a point in your recovery where you no longer need to take anxiety medication. Research shows that behavioral treatment alone or combined with medication is highly effective for the treatment of anxiety disorders. These are various types of therapies that are used in treatment of anxiety disorder. Anxiety disorders themselves vary significantly, so the type of therapy that would be carried out on a patient depends on their specific details of their circumstance and condition. A person with agoraphobia would need to go through a different treatment process from a person who has post-traumatic stress disorder. The thought of going for therapy can be daunting for many people. The mental image attached to the word therapy is that of being in an old-fashioned office, staring up at the ceiling, enduring unbearably boring therapy sessions. While this stereotype is often the case, there are many great therapists that will engage you in interesting discussions that will help you uncover the foundational cause of your anxiety. They will also provide you with a comfortable environment where you can identify, confront, and overcome your triggers without fear. The duration of the therapy treatment will depend on the type and severity of the anxiety disorder, but this is not a problem since people typically begin to see fantastic results in a short amount of time. People experience significant improvements within 8 to 10 therapy sessions. While several types of therapy are used in the treatment of anxiety, the most effective approaches are exposure therapy and cognitive behavioral therapy, CBT. Each therapy can be administered alone or combined with other types of anxiety therapy. Therapy can also be conducted individually between a single therapist and a single patient, or with a group of people that have similar conditions and one or more therapists. The complex nature of anxiety has resulted in the development of many types of therapy, but which ones have proven to be the most effective? Cognitive behavioral therapy, CBT. According to research, cognitive behavioral therapy, CBT, has proven to be highly effective in the treatment of social anxiety disorder, phobias, panic disorder, and generalized anxiety disorder, which has directly resulted in it being the most widely used therapy for anxiety disorder. It is a combination of cognitive therapy and behavioral therapy. During CBT therapy, the major focus is changing perception from a self-absorbed, negative outlook to a more assured and positive perspective on life situations. CBT helps you to build understanding that you need a healthy internal system in order to function effectively in the world, and enable you to control your behavioral and emotional responses in any situation, regardless of the stimuli. When a person's perception is distorted, it causes a lot of anxiety. This is why the focus of CBT is to change the lens through which people look at their triggers. Just as its name implies, it involves two significant components: cognitive therapy and behavioral therapy. Through cognitive therapy, the patient and therapist can work together to identify the basics of cognitive restructuring. This will help them examine how negative thoughts trigger and contribute to anxiety. During cognitive therapy, patients are taught to replace negative thoughts with more realistic thoughts and through an optimistic lens. Behavior therapy oversees how you behave and react in situations that could trigger anxiety. During behavior therapy, your psychologist will encourage you in anxiety-provoking activities, and you'll learn that your feared outcomes are unlikely. Cognitive behavioral therapy is an effective treatment for a wide range of mental health conditions, including autism spectrum disorder, ASD, mood disorders, and major depression. Exposure therapy. Exposure therapy, as the name suggests, exposes you to your triggers in a therapeutic manner. The philosophy behind exposure therapy is that by repeatedly exposing you to things that make you anxious and afraid in a considerate and gradual pace, you'll eventually feel a sense of control over those triggers and overcome your involuntary anxious reactions. Exposure therapy is commonly used to treat anxiety-related disorders, like social anxiety and PTSD. There are two ways that exposure therapy is usually approached. The therapist will either ask you to create a terrifying scene in your mind or make you confront it in real life, at a pace you're comfortable with. The process of gradually exposing people with anxiety to their fears is done using a technique called systematic desensitization, which allows you to gradually challenge your fears, build confidence, and learn how to use practices and techniques learned during practice in real situations. Systematic desensitization involves three distinct parts. Relaxing. Your therapist will teach you relaxation techniques, such as progressive muscle relaxation, guided imagery, and deep breathing to help manage your anxiety symptoms. Identifying triggers. Your therapist will help you create a list of your triggers, ranking them in order of their magnitude. Exposure. Your therapist will gradually expose you to anxiety-provoking objects or situations while you practice using the relaxation techniques you learn to manage your level of anxiety. There are several ways a therapist could expose you to anxiety triggers, including imaginal exposure and virtual reality exposure. Dialectical behavioral therapy. Dialectical behavioral therapy, DBT, is a highly effective type of CBT. Originally used to treat borderline personality disorder, BPD, DBT is now used to treat a variety of conditions, including anxiety. DBT focuses on helping you develop an opposite alternate outlook, change, and acceptance. During DBT treatment, you'll learn to accept your anxiety while simultaneously working on it. It's simply knowing where you are and where you'd like to be. DBT treatment teaches four main skills: mindfulness, connecting with the present moment while noticing your thoughts as they pass out without having a hold over you; distress tolerance, the act of successfully managing your anxiety when faced with a turbulent situation; interpersonal effectiveness, learning how to say no or asking for what you need; emotional regulation, managing anxiety before they get out of control. Interpersonal therapy. Interpersonal therapy, IPT, is a form of psychotherapy that focuses on social roles and relationships and is commonly used in the treatment of depression and anxiety disorders. During IPT, you'll learn how to recognize interpersonal issues, such as conflicts with loved ones, unresolved grief, avoidance, and general communication problems. During IPT, with the help of your therapist, you'll be able to learn effective ways to communicate information and emotions to other people. That brings us to the end of today's video. If you found this video helpful, you can help us by hitting the like button and subscribing to our channel. You can also help us by hitting the bell button so you'll be among the first to know when we drop a new video. Have a great day.